office for today. So that's really nice. We'd just like to welcome all of you here and thank you so much for joining us. Today we're going to be talking about allergies, asthma, and eczema, and how all of these things are related and how they can be successfully treated with natural medicine. Again, I just really want to thank you for joining me. And my name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we must attend a four-year medical school. We are trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. And before we begin, I just wanted to let you know that if you have any questions that you would like to talk with me about personally, that you can call our office. We offer a no-charge phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and develop a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 and text free, or you can text free consult to that number. Or you can click on the contact button on our Facebook page. Our staff will contact you to arrange a no-charge phone consultation, and you'll also find all the contact information right here on our Facebook page. So let's get started, and please feel free to use the comment section to ask questions as the talk progresses. Today, I wanted to start with a story about what one family felt was a medical miracle, in a way. So these parents brought their daughter to me. She has a diagnosis of autism. And when they first brought her in, I could see right away how troubled they were. Their facial expressions looked really worried. Their breathing was heavy. I could tell they were really carrying quite a burden. And then I found out why. Their daughter, who was 6 at the time, had allergies and asthma and eczema. And because she had autism, she had a hard time really expressing when she didn't feel good. They could see when she was having symptoms, but one of the things that they noticed was, or one of the concerns was that she was having a lot of behavior problems. She would sometimes lash out or would scratch other people or would just get aggressive sometimes. And, and so it was recommended that she was put on drugs that would sedate her to address the behavior problems. But I could see when I saw her that she really didn't look well. She had dark circles under her eyes. She had, these really red, watery eyes. When I listened to her lungs, I could hear her wheezing. It was like, and then and there are also other types of abnormal lung sounds that I could hear. Her eczema was really ugly. Her skin was red and raw. She was scratching all the time, and because she had a diagnosis of autism and she couldn't understand why she shouldn't scratch, she would just scratch because it was itchy, and then her skin would get open, it would get infected, and then they'd have to put antibiotic creams on her or antibiotic ointments, and then it would turn into infections. And so even more so, we'd have all of these issues. And the parents had taken their daughter to conventional doctors. They treated her with antihistamines and inhalers and steroid creams. But these, while they helped a little bit, they really weren't providing any kind of long-term relief or long-term solutions. Even with the antihistamines, she was still having a lot of allergy symptoms. She had to use inhalers every single day. And with the steroid creams, then they would put the steroid cream on, and then it would make her eczema go away for a little bit. But then as soon as they stopped using the steroid creams, the eczema would come back and it was even more angry and red and itchy than before. And so it just really wasn't a long-term solution. And also her allergies would make her asthma worse. So every single time she would get allergy flare-ups, then she would start to get more asthma. The asthma would turn into lung infections a lot of times, and then she had to take antibiotics, and the antibiotics would make her stomach sore. So it was just like this really bad downward spiral, this cascade, that they were caught in this vicious cycle, and they were just saying, we don't know what to do. And especially seeing her acting out and throwing tantrums and having behavior issues, it was really painful for the parents to see, because they would just say, it just feels like she's just not comfortable in her own skin, and she didn't look happy, she didn't look healthy. And unfortunately, her regular doctors hadn't done any lab testing for her. So I had some lab testing that was done. We did test her for food allergies as well as environmental allergies. And then we found out that she had certain foods that she was allergic to, as well as certain foods that she was sensitive to that were a problem. And so those were certainly some problems. We also tested her vitamin D levels, because vitamin D is really important for keeping your immune system balanced. And we found that her vitamin D levels were too low. And that was a problem that was contributing to all of these immune system issues. And we also tested her copper and her zinc levels. And it's really important that your copper and zinc are balanced. They should be at a 1-to-1 ratio. Both of them, I like to see about 100 on blood tests. And her copper zinc ratios were off. And her copper, meaning her copper was too high and her zinc was too low. And we found some other issues also with her immune system and with other things in her body. So what we did was her parents started changing what she was eating. So I recommended that they take out those foods that she had allergies to and sensitivities. So they took those foods out of her diet. I also recommended certain supplements, vitamin D and zinc, and also some homeopathic medicines that I use a lot that help to balance the immune system. And what we saw was that her allergies started getting better and better. And pretty soon the parents found they didn't even have to use antihistamines anymore. And her eczema cleared up completely with all of those things. I mean, it looked just like perfect little girl's skin should look. And then also her asthma cleared up almost entirely, where they told me over time they didn't use the inhalers, and they eventually found they didn't have to use the inhalers at all. They still had them on hand just in case, but they didn't have to use them anymore on a daily basis. And on top of that, her behavior improved dramatically, where she wasn't in pain all the time. And she stopped having all these meltdowns, this aggressive behavior, and the dark circles under her eyes cleared up, and she just looked so much happier and healthier. She also was able to stop having to go on antibiotics all the time for all of these infections. And that really helped with healing her digestive system. And that also in turn helped her immune system to get back into balance. And I just remember the tears in the eyes and the look of relief on her parents' faces, because for them it was really like a miracle. And so, and that's really, I tell patients that's why I do what I do. It's to see patients getting better and to see them. I mean, I'm not opposed to the use of drugs, but it should be that we're really trying to figure out the underlying causes and treating these underlying causes to be able to help people really get better, and that we're not just putting a Band-Aid on a lot of these symptoms. So I'm always interested in the medical and scientific understanding, so that I can really figure out again what is the underlying cause. And I believe that miracles can happen. Um, so I want to give you some medical knowledge as to what was happening in this little girl's body. And most people don't even realize that allergies and asthma and eczema actually can all be related. So they are all indications of the same kind of immune system imbalance. So if someone has any one of these conditions, allergies, asthma, or eczema, then they have a higher risk of developing the other two. And why is that? What's going on in the body? Well, what's happening is that there's one type of antibody, which is a protein that your immune system normally uses to attack things that could make you sick. And this one type of antibody is called IgE. And when IgE it's too high, then you can have these conditions and these symptoms because the immune system is out of balance. And when IgE is too high, then it shows up in different ways. So it can show up on the skin with eczema, it can show up in the lungs with asthma, and then it can show up in the head, area, ear, eyes, nose, throat area, where people are having really bad allergies, they're having itchy, watery eyes, itchy, red, watery nose, sneezing, just constant, having to use your tissue all the time. So that's one of the things. Another factor is there are genetics and then family history. So the patient's parents actually had some allergies to pollen, and so there was a genetic component to this particular case. And there are also potential environmental factors that can be a problem. So, for example, living in an area where there is a lot of air pollution or where pesticides are sprayed in the air, that can certainly cause irritation and can cause more stress on our respiratory system, on our lungs. Because obviously it's not good to breathe in pesticides or some of these other kinds of issues, toxins. When it comes to eczema, soaps or chemical cleaners or other things that irritate the skin can actually set up a person for this troubling condition. And then if the IgE levels become imbalanced, then the person is more likely to get eczema because the irritation already stimulates, there's already irritation in the body. And then when there's this immune system imbalance, then it can be more likely to cause further and further issues. So sadly, these conditions, especially allergies and eczema, are more typical in children with autism than in the general population. I've worked with hundreds of children with autism. Imagine what it would be like to have allergies. Think of, if you have allergies, or if you see friends, or if you have allergies yourself, how much it really can bother you having allergies, itchy, watery red eyes, the stuffed up nose, the pressure over here or over here, headaches, and add to that constant skin irritation, and then you're having trouble breathing. And then imagine not being able to communicate, not being able to tell somebody, my skin hurts, or I have a headache, or I can't breathe. And you don't even know how to say that or what to say, and you're trying to communicate, but it's not working. Could you have any doubt that would frustrate you, right? Of course, that would frustrate anyone. But then if you think about times when you're sick and you're not feeling good, we're really not in the best mood. And sometimes if you're feeling sick and you're feeling tired and run down, and then you have all of these demands put upon you, you're not going to be in a very good mood, right? And you're not going to be feeling the best. And so for a lot of these children with autism, they can't always say, oh, I have a headache, or it hurts over here, or I can't breathe, and or my skin hurts. And so their parents don't always know what's going on with them. And that's frequently, it can oftentimes when we see aggression, or when children are self-injurious, meaning that they're banging their head on the wall, or they're hitting their head with their fist, or they're hitting their head on the floor, or they're biting themselves or scratching themselves. Oftentimes it's because there's some kind of underlying issue going on with them that they don't feel good. And so then they could be more moody, more grumpy, more uncooperative, and they can be more likely to be aggressive, or have these self-injurious behaviors. And this can also be why they may have difficulty with attention or focus, and that it can look like ADHD symptoms. And I've seen a number of individuals, not with autism, but with ADHD, where I test them, and lo and behold, we found out that they actually had allergies to certain things that they had no idea. And some of these patients actually didn't have any classic types of allergy symptoms. But interestingly, I had a patient that he was a young man in his 20s. He didn't have any allergy symptoms at all. And then I tested him for food and environmental allergies, and we found that he had actually a lot of really low-level types of allergies to a whole bunch of foods, and to a whole bunch of pollen and dust mites and other kinds of things. And his only symptom was he just had a lot of trouble focusing and paying attention. And so we took these foods out of his diet and had him avoid these things and address some of these things with dust mite allergies. And lo and behold, his focus and attention improved. And so that's what I mean by there can often be these underlying issues. Sometimes, even when there again, where I've seen cases like this where there are actually no allergy symptoms, classic allergy symptoms like the itchy red watery eyes or itchy red watery nose, those kinds of things. So for children with autism particularly, it's really important to find out what kinds of things they're reacting to, whether it's food or environmental or both. And once that's discovered and treated, then we've seen a whole lot of improvement with behavior and focus and attention. So these are the problems. What are the solutions? So I'm going to go into that in a little bit and give you the inside scoop in terms of what we really need to do to treat this comprehensively, treating the underlying causes and really getting the system back into balance so people don't have to be suffering with allergies and asthma and eczema. Before we go on, I just wanted to pause to remind you that if you're just joining us, we do offer a no-charge phone consultation if you want to talk with me personally about any health concerns that you have. Arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Or you can text free consult to that number. Additionally, in conventional medicine, when we have when you have allergies or eczema, I have seen patients who have come in where they actually weren't tested for what are your specific food allergies or environmental allergies. Many times they are, but sometimes they're not. And the doctor just says, well, we're just going to treat you with an antihistamine anyway, so just take this. And also when people have seasonal allergies, oftentimes they're not tested for food allergies. But very often when I've seen patients come into my office, I've often seen people who have what seem to be seasonal allergies. And yes, we do find, yes, they have allergies to pollen or to dust mites or whatever it is. But I will also test for food allergies because the reason is, again, if they're making too much of this antibody, IgE, and there are foods that are contributing, even if they don't notice bad allergy symptoms right after they eat. I've seen that definitely in a number of cases, people actually do have food allergies. And when they take those foods out of their diet or reduce those foods, then they find that, wow, like my seasonal allergies are all of a sudden they're better. Or they find that, oh, I'm not having these constant like sinus headaches all the time. And so food allergies can certainly be a contributing factor to those. I also like to check for food sensitivities. This is with a different type of antibody, which is called IgG. And IgE and IgG are two totally different antibodies or proteins. So it is helpful to do tests for both because they are two totally different antibodies. It's possible that you can have reactions to foods with IgE and not IgG, or vice versa. They're basically on those two tests, there can be completely different foods that might come up. And those are helpful to know because in the case of this young girl with autism, we found that when we took the food sensitivities out of her diet, then also she was feeling better. And then her asthma and her allergies and her eczema were better too. So that's why it's helpful to check for both of these kinds of things. And what we see is that it's really looking at the whole picture. So rather than just saying, okay, we'll give you a steroid cream for your eczema, and then we'll give you an inhaler for your asthma, and then we'll give you antihistamines for your allergies, we really need to look at the immune system as a whole and see why is your immune system out of balance. Because in the case of all of these things, particularly allergies, but with other, with asthma or with eczema as well, sometimes what's happening is that the immune system is actually attacking these things that are not usually a huge problem, or normally shouldn't be a huge problem. So what I mean by that is that normally your immune system should be attacking things that can make you sick. So like, for example, bacteria or viruses or parasites or other kinds of things, fungus or yeast or mold, things that can make you sick. Normally, it's what your immune system is supposed to attack. And I give patients the analogy of a soldier, and like your immune system is like your soldier, and your immune system is your defense. And think of this like the soldier that is guarding your body. And your immune system, normally what it's supposed to do is it's supposed to shoot and attack the things that can make you sick. So like I mentioned, bacteria or viruses or mold or yeast or parasites. Things that can make you sick, that's like the enemy. That's what your immune system is supposed to attack. But what happens in the case of allergies, what's going on is that your immune system is actually attacking whatever it is you're allergic to. So for example, it could be dust mites or pollen or dairy or gluten or whatever you're allergic to, or other kinds of things. And what's happening is that actually your immune system is not really supposed to be reacting to like pollen, for example. There's nothing inherently harmful about pollen itself. But what happens is in the case of allergies, your immune system is actually attacking the pollen. And when I talked about that antibody, the IgE, that's what happened. That's what's happening is your body is making this antibody, this protein, that is then going and it's attacking the pollen. So every time you get exposed to pollen, if you have pollen allergies, then you get all of these symptoms, red, itchy, watery eyes and stuffy nose and sinus congestion and everything. And that is actually, those symptoms are actually from your immune system's reaction to those things. So the analogy I give is that, for example, like the soldier is supposed to be shooting the enemy, but say the soldier sees a squirrel running by, and then it's like, squirrel, boom, 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 and it's like shooting the squirrel. And that's actually what's happening in the case of allergies. Like the squirrel is not actually going to hurt the soldier, right? But then the soldier is shooting at the squirrel and wasting all of its bullets shooting the squirrel. And sometimes in this instance, in this analogy, the soldier gets so caught up with shooting the squirrel that it actually forgets to pay attention to the stuff it's supposed to be attacking, like bacteria and viruses that could make you sick. And so, for example, in this analogy, the squirrel is like, for example, the pollen that you're reacting to. Your immune system is shooting the pollen, which, really shouldn't be. It's supposed to be attacking stuff that can make you sick. And so what we want to do is we want to look at the immune system as a whole, and we want to try to re-educate the immune system to say, it's kind of like going up to the soldier and saying, it's okay, you don't have to shoot the squirrel. It's okay, the squirrel is not going to hurt you. And then it's like telling the soldier, okay, you see that over there? You see that that's the enemy, the bacteria and the viruses, the stuff that can make you sick, that's the enemy. That's what you're supposed to attack, and that's what you're supposed to shoot. So what we want to do is we want to look at the immune system again as a whole and try to re-educate your immune system that you don't have to attack all of these things that it shouldn't be attacking, like the squirrel, like pollen or dust mites or whatever it is. So how do we do that? I will look at, as I mentioned earlier, I look at vitamin D levels. That's one important component with trying to re-educate the whole immune system. So vitamin D is a very important vitamin for keeping your whole immune system balanced and in balance, where the soldier is not shooting at the squirrel. Very, very often, I find that people who have allergies and eczema and asthma, very often, they tend to have vitamin D levels that are too low. And so we'll test their vitamin D levels. I like to see that vitamin D levels are about 50 to 80 nanograms per mil on blood tests. So again, 50 to 80. And if it's lower than that, I will often recommend they take a supplement, try to get more sun exposure. We of course want to use your common sense in terms of sun exposure because of risk of skin cancer and things like that. So I'll look at those things. I also mentioned earlier with the example of that girl, I test copper and zinc levels because copper and zinc need to be in balance to keep the immune system in like a balanced state. And I also take a history of patients' antibiotic use because antibiotics will definitely affect the good bacteria and the bad bacteria in our gut, and also the good bacteria, or so the good yeast and the bad yeast in our gut. And we know now that our gut is actually really important for normal functioning of our immune system. So we find that our gut is really important. The bacteria, the normal bacteria in our gut, are really important for keeping our immune system from developing allergies or autoimmune diseases, and also keeping our immune system strong so that we can attack the things that we're supposed to attack, like the bacteria and the viruses, right? The enemy, the things that can make us sick. But there's good bacteria too that are really important. And so I work with patients to try to upgrade their food choices. So for example, eating fermented foods. Fermented foods are a natural source of probiotics. There's also foods called prebiotics, which provide the sugars and the fibers that help to support your normal good bacteria that's supposed to be growing in there. So prebiotic foods can include things like asparagus or chia seeds. It can also include banana, burdock, which is global root for local people. And there's a lot of root vegetables that provide a lot of really important prebiotics. So jicama or sweet potatoes or taro. So a lot of these provide these really important types of prebiotic foods, these fibers and sugars that you need for normal gut balancing. And so we will also look at foods that can create more inflammation in the body. So these are typically things like a lot of really sugary foods like candy or soda, a lot of processed foods, fried foods, mostly a lot of junk foods, really. So eating a lot of these can create too much bad bacteria and not enough of the good bacteria that we need to help keep our immune system in balance. So it's about looking at those kind of things. And then besides improving food selection, I also use homeopathic medicines to help balance the immune system and kind of, again, part of that whole picture of trying to re-educate the immune system. There are also allergy desensitization drops that I use. And those are basically drops that we have people put under the tongue that are trying to help to decrease people's reactivity to allergies in the first place. I also use and prescribe medical grade supplements and herbs that also help to decrease inflammation, help to balance the immune system, and really help to put someone on the path towards healing. By using this naturopathic approach, which is focused on determining the causes of allergies, asthma, and eczema, my patients very often find relief. And we find that we're often able to gradually reduce the need for pharmaceutical medications. Again, with patients with asthma, I'm not suggesting that you should just stop using your inhaler, of course. However, what we want to do is we want to treat the underlying causes so that people can decrease the need for having to use their inhaler. And very often I find that as we treat these underlying imbalances, then many patients, they find, wow, they don't have to use their inhaler as often. And I've had a number of patients come in where they had to use inhalers every single day. And then as they're getting better, they find, oh, I don't have to use my rescue inhaler as often. And they're feeling a lot better. And then we'll work with them to gradually try to wean them down on their inhalers. And they find they don't have to use them as often. And in many cases, like with the case of this young girl, she really didn't have to take them at all on a daily basis. And so, there's, and I'd like to say there's really more to my treatment protocol than just finding and addressing the underlying causes of disease. When you really think about it, this is a way that we can empower you as a patient to be able to understand what is happening in your body and how we can help to put you in charge of your own health and your own well-being. So what have we covered today? We learned that allergies, asthma, and eczema are immune system issues related to an antibody or protein called IgE. We discovered that conventional medicine typically treats these conditions by treating the symptoms, and that often these tests to identify these underlying issues often are not done, like testing vitamin D and copper and zinc, for example. And we find that the naturopathic approach will test to determine what are the causes for each of these individual people, and then using a protocol to really treat these causes where it's individualized for each person. So again, if you would like to talk with me personally about any health concerns that you have, you can just call our office to arrange your personal health strategy session. Our phone consult for people who are interested in talking with me one-on-one, we're offering it for free. Just call our office at 808-425-2987 or text free consult to that number. You'll find all the contact information right here on our Facebook page. Mahalo, and we will see you in 2 weeks. Aloha.